Hello, Gold viewers. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for the Gold Midwifery Online Conference 2015. Welcome to my interview with Dr. Rachel Reed. I'm absolutely delighted to be sitting down today with Rachel and chatting about her up-and-coming presentation at our conference titled Placental Birth. Welcome, Rachel. Lovely to be here with you today.
Hello, thank you for having me.
So I'm just going to jump in here. I've got a couple of questions for you, Rachel, and I want to know more about what you have been studying. So what first caught your attention about this particular topic?
Well, interestingly, this particular topic is probably my least favourite part of birth. It probably always has been. I've always had issues around placental birth, and really that's what led me into finding more out about it and really getting into the research and the literature and finding out what other people do and how women experience it. So it's kind of come from not particularly liking that part of birth myself as a midwife. So that's what led me to placental birth.
Excellent. So something that you didn't like so much became your study topic, shall we say. So can you tell me, do you feel that we can really improve on what our practices are at births today?
Oh, yes. And I think that one of the problems is that we look at birth as distinct stages and we focus on the third stage, which I've specifically not called it the third stage in my presentation, because there aren't stages. So we look at just the birth of the placenta and then look at what happens there and then consider, how can we minimize bleeding? How can we effectively get the placenta out without actually going all the way back through the entire labor process, even before that? That actually the birth of the placenta is just one part of a physiological process, which is the birth of the baby in the placenta. And I think if we come at it from that perspective and then think about our practices around that in the context of our practice for the entire birth process, then I think that can help us provide a more effective environment, I guess, for women to physiologically birth their placentas. And there's certainly teaching students, placental birth is often a very frustrating part of their education, and I've discussed that in the presentation, that there isn't really a right way to do it. And they want answers, where if you're actively managing the placental birth, when do you give the oxytocin? When do you pull the placenta out? Do you pull the placenta out? And every midwife they work with does something different. And every woman that they work with will want something different. So it's trying to provide individualized care for women, holistically looking at their whole birth. Was it a physiological birth? What's going on for them at this moment, and then trying to create an environment for that woman that facilitates an effective and safe birth of her placenta. And it's just so complex that it's a huge topic and can be very frustrating because there aren't any absolute answers. So I'm not going to promise to give absolute answers. We'll talk about the research and we'll talk about some different scenarios and situations. And hopefully everyone will feel a little bit more confident about that part of birth afterwards.
Well, thank you so much, Rachel. I'm certainly very much looking forward to hearing more about this probably complicated, situation that can happen where there isn't that one right answer, where the needs of the mother, comes into play, and the individuality of the care provider and what it looks like. But we're certainly looking forward to hearing you share the research on this topic for sure. Well, we have run out of time today, and I appreciate you being with us here, and I'm looking forward to hearing more of your presentation at our conference. And thanks to everyone for listening in, and we'll look forward to talking to you soon. Thank you again, Rachel. Bye-bye.